Parents think age 5 daughter had bruise on back of knee. Then doctors reveal horrifying truth. Caitlin Donovan, age 5, was so distracted when she was playing in her backyard that she didn't feel the slight pinch of a bug bite. It wasn't until last week that the little girl's parents noticed a small purplish bruise on the back of her knee. John and Christine Donovan didn't think much else of the marking until the bruise began to grow larger and Caitlin developed a fever. Doctors from Mendon, Massachusetts quickly diagnosed the mark as a spider bite and sent her to an emergency room to receive antibiotics. When the medicine did nothing to help Caitlin, her parents then drove her to a pediatric infectious disease specialist for further help. There they learned Caitlin was bitten by a black widow, the most poisonous spider in North America. Although the little girl is now recovering, John and Christine are warning other parents to be aware of dangerous insects lurking in the backyard. Black widow spiders have long been feared due to their toxic poison. The scarlet marking on its body warns off a potential predator, indicating that its venom is dangerous. An average of 2,000 people every year are bitten by black widows in the U.S. While the spiders are the most poisonous spiders in North America, their bites cause very few deaths. This doesn't mean they're harmless, though. Their bites can result in severe muscle pains, cramps, fever, nausea, and mild paralysis of the diaphragm. If bitten by a black widow, medical assistance should be sought in order to get an antivenom serum. Although black widow bites can be deadly, only a few deaths have been reported. An average of 2,000 people a year are bitten by the insect. Christine is urging other parents to inspect their child after playing outdoors and to push for answers if they notice something strange. Speaking to CBS News, Christine said she never felt it bite her. It could have been in her jeans in the location where she bit. We don't know. She's happier now that we're not in the hospital. It doesn't seem to bother her. She looks at it, she doesn't think it's gross, so I try not to make a big deal out of it to make her nervous or anything. Dr. William Durbin, the specialist at UMass Memorial Medical Center, told the Donovans they were right to bring Caitlin in. Otherwise, things could have been worse. Speaking to Boston Globe, Dr. Durbin said her dark purple bite signaled cell injury. She added, she had a very distinctive bite, which was scary for her parents and of course the doctors too. Black widows are known for its telling red markings on the body, signalizing its poisonous venom. Black widows are also one of the few kinds of spiders that have fangs long enough to penetrate human skin, and venom strong enough to severely affect a human being. A bite mark is identified as 2 small puncture wounds and symptoms normally appearing within an hour. The poison attacks the nervous system, resulting in severe muscle pain, cramping, nausea, fever, and mild paralysis of the diaphragm, which makes breathing difficult. Most victims recover without serious complications, but medical attention should be sought out so an antivenom serum can be administered. Black widows get their name because they eat their mates, a practice called sexual cannibalism. These types of spiders are normally found in southern and western areas of the United States. While it's uncommon to find black widow spiders in Massachusetts, Dr. Durbin says they're around. They generally leave people alone unless someone comes into contact with one of their webs, which are commonly found in woodpiles, fences, and other areas where debris is accumulated, according to the CDC. Another poisonous spider found in North America is the brown recluse spider, and they're most active in the warmer months. These bites differ from black widows because their venom destroys the walls of blood vessels near the bite, sometimes causing a large ulcer. The wounds can take months to heal and can become infected, and although deaths are rare, it can occur.